This video is brought to you by Global Men's Wellness, your 24/7 AI health expert. No copays, waiting rooms, or awkward conversations. Just real answers whenever you need them. Visit globalmenswellness.com to try it free and get your own on-demand concierge-level wellness expert today. Welcome to the Global Men's Wellness. I'm Dr. Judson Brandeis, and I'm so glad you're here. It is the most common solid cancer in young men, striking at a time of life often associated with peak health and vitality. A diagnosis can feel like a sudden, terrifying disruption, raising immediate questions about survival, fertility, and long-term well-being. But what if I told you that this is one of the most curable of all solid cancers? That for the vast majority of men, a diagnosis is not a death sentence, but the start of a journey with an overwhelmingly positive outcome. The story of testicular cancer over the last 50 years is one of incredible medical progress. We have moved from an era of uncertainty and aggressive, often debilitating, treatments to a new paradigm of care, one that is highly personalized, evidence-based, and focused not just on curing the cancer, but on preserving a man's quality of life for decades to come. Today we're going to explore this remarkable success story and the sophisticated framework that guides the diagnosis and management of early-stage testicular cancer. So, what exactly is testicular cancer? At its most basic, it is a solid mass that forms in the testis, and it should be managed as a malignant tumor until proven otherwise. This cancer is unique in that it is one of the few malignancies with reliable blood tests called serum tumor markers that are essential for diagnosis, staging, and monitoring. These markers, AFP, HCG, and LDH, should be measured before any treatment begins, as their levels are critical for making informed decisions. Testicular cancer is broadly divided into two main types: seminoma and non-seminomatous germ cell tumors, or NSGCT. This distinction is critical because it has profound implications for treatment. Pure seminomas tend to develop at a later age, are often diagnosed at an earlier stage, and are extremely sensitive to both chemotherapy and radiation. NSGCTs, on the other hand, can be made up of several different cell types, such as embryonal carcinoma, yolk sac tumor, choriocarcinoma, and teratoma. Teratoma is a particularly important component, as it is resistant to chemotherapy and can only be cured by surgical resection. The biology of testicular cancer management revolves around a precise, risk-stratified approach. After the initial diagnosis, which is confirmed by a radical inguinal orchiectomy, the surgical removal of the affected testicle through an incision in the groin, the patient undergoes a staging process. This involves a physical exam, post-orchiectomy tumor marker levels, and imaging of the abdomen, pelvis, and chest to see if the cancer has spread. For men with early-stage disease, where the cancer is confined to the testis or has only spread to the retroperitoneal lymph nodes, the goal is to provide the least amount of therapy necessary to achieve a cure, thereby minimizing long-term side effects. For stage 1 seminoma, where the cancer is confined to the testis, the recommended approach is active surveillance. This involves regular checkups, imaging, and blood tests to monitor for any signs of recurrence. For stage 1 non-seminoma, the options are more varied and depend on the presence of risk factors like lymphovascular invasion. The choices include surveillance, a retroperitoneal lymph node dissection, RPLND, or 1 to 2 cycles of chemotherapy. The modern management of testicular cancer is built on a foundation of decades of clinical trials and systematic reviews of evidence. The 2019 AUA guideline, amended in 2023, is a testament to this, providing a comprehensive and proven framework for clinicians. For example, the recommendation for surveillance in stage 1 seminoma is a strong recommendation based on grade B evidence, reflecting the fact that over 80% of these men are cured by orchiectomy alone, and those who do relapse are almost always cured with salvage therapy. The guideline also emphasizes the importance of multidisciplinary care involving urologists, medical oncologists, and radiation oncologists to ensure that every patient receives the most appropriate and personalized treatment plan. Despite being a model of curable cancer, there is still a lack of public awareness about testicular cancer and its management. The rarity of the disease, combined with a natural reluctance to discuss testicular health, contributes to this. Diagnostic delays, often due to both patient and physician factors, can lead to more advanced disease at presentation and may necessitate more intensive therapy. It is also critical for men to understand that while testis cancer has an excellent prognosis, the treatments themselves can have long-term side effects. Fertility is a major concern, as chemotherapy and radiation can impact sperm production, and RPLND can affect ejaculation. For this reason, sperm banking should be offered to all men prior to any treatment beyond orchiectomy. For a young man diagnosed with testicular cancer, the experience can be overwhelming. The initial step is a radical inguinal orchiectomy, which is typically an outpatient surgery. After a period of recovery, the focus shifts to staging and determining the next steps. For men on surveillance, the experience involves a regular schedule of visits for physical exams, blood tests, and imaging, typically for at least 5 years. This requires a commitment to follow-up, but it spares the vast majority from the side effects of additional treatment. For those who require chemotherapy, the experience involves several cycles of treatment, which can be associated with side effects like nausea, fatigue, and hair loss. For those who undergo an RPLND, it is a major abdominal surgery that requires a hospital stay and a period of recovery. Personalized urologic care is the cornerstone of modern testicular cancer management. The decision-making process is a shared one between the patient and a multidisciplinary team of experts. For a man with stage 4 non-seminoma, the choice between surveillance, RPLND, and chemotherapy is a complex one, with trade-offs between the risk of recurrence, the upfront morbidity of treatment, and the long-term side effects. A young man who wants to avoid chemotherapy at all costs might opt for an RPLND, while another may prefer surveillance, accepting the risk of relapse to avoid immediate surgery. An expert review of the pathology is also critical, as the presence of certain features, like variant histology, can significantly impact the treatment plan. Furthermore, in highly selected cases, such as a man with a tumor in a solitary testis, a testis-sparing surgery may be considered to preserve hormonal function, although this comes with a higher risk of local recurrence. The effectiveness of the modern, risk-stratified approach to early-stage testicular cancer is truly remarkable. For stage 1 seminoma managed with surveillance, the cure rate is nearly 100%. For stage 1 non-seminoma, depending on the management strategy chosen, the long-term survival rates are also well over 95%. Even for men who relapse, salvage therapy with chemotherapy or surgery is highly effective, leading to a cure in the vast majority of cases. The success of this approach is a direct result of a deep understanding of the disease's natural history and the ability to tailor treatment intensity to the individual patient's risk. The future of testicular cancer care is focused on further refining our ability to personalize treatment and minimize long-term toxicity. This includes the development of better prognostic models and biomarkers that can more accurately predict who is at risk of relapse, allowing us to further de-escalate treatment for low-risk patients. There is also a great deal of research into survivorship, with a focus on mitigating the long-term risks of treatment, such as cardiovascular disease and secondary malignancies, and on better supporting the fertility and psychosocial needs of young men who have been through this journey. I do this work because the story of testicular cancer is one of the great triumphs of modern oncology. It is a story of how a dedicated, multidisciplinary community of clinicians and researchers can turn a once-feared diagnosis into a highly curable disease. It is a testament to the power of evidence-based medicine and personalized care. For the young man facing this diagnosis, the message is one of hope. There is a clear, proven path forward. By working with an experienced team and engaging in a shared decision-making process, you can navigate this challenge and look forward to a long, healthy, and fulfilling life. There is a better way, and we have found it. Take control of your health anytime, anywhere. Visit globalmenswellness.com and start your free trial today. Get expert-level answers in seconds, not weeks, without the cost, the wait, or the awkward conversations. Real support on your terms. Visit globalmenswellness.com now.